Moving to Switzerland or just settling in? One of the first things you will need to figure out upon arriving is the Swiss health insurance, and trust me, it can be a lot. If you're anything like me when you first move here, you'll probably be wondering, where do I even start? Today I will share the basics and essentials that you need to know about Swiss health insurance, some of the tips that I wish I knew before getting my own Swiss health insurance, and also some things to make the process a whole lot easier. If you're new to the channel, welcome, my name is Olivia, and I do videos related to Swiss travels and living in Switzerland. If you have not yet done so, now's the perfect time to hit the subscribe button and turn the notifications bell on so you don't miss any of my videos. And without further ado, let's get going. Let's start with the basics. So in Switzerland, a basic health insurance is compulsory. It's not optional, you're not able to opt out the system. The basic health insurance covers the essentials such as visits to the doctor, emergency cares, hospital stays in your canton, and also maternity services. You are responsible for getting it yourself. Most of the time, your employer doesn't do it for you unless you have some special employment perks whereby the health insurance is tied to your employment and is offered by your company, but most of the time you're required to obtain the Swiss health insurance on your own, which means to say that you are responsible to choose the provider, the plan, and to make sure that it fits your needs and your family's needs. So personally, I think the basic health insurance, as name suggests, is the essential. It covers most of the basic stuffs that you will require, but as I learned the hard way, it doesn't cover everything. So dental services is not covered, and if you are seeking alternative treatments, for example, like acupuncture, is also not covered by the basic health insurance. More on that in a little bit. Next, let's talk about the cost. Just how much does the basic health insurance cost? To answer that question, it actually depends on a lot of factors. The premium that you pay for your basic health insurance will depend very much on the following factors: your age, your gender, your canton of residence, and also the deductible that you choose. So to understand what exactly is a deductible, what exactly is the franchise, this is how it goes. Deductible is basically the amount that you pay out of your own pocket before your insurer covers anything. For instance, in my case, because I'm relatively young and healthy, I opted for the highest franchise of 2,500 Swiss francs, which means to say if anything happens to me, if I were to get into if I were to fall sick or if I require doctor visits, I will have to pay 2,500 francs out of my own pocket before my insurer will cover anything else of my treatments and services. And even after that, there will still be, I think it's a 10% co-payment. On the other hand, if you choose a lower deductible, for instance, like a deductible of 300 francs, it means that you only need to pay out of pocket for 300 francs before your insurer covers the rest of the bill. But that also means that you have a higher monthly premium. That means you pay more per month, but when you go to the hospital or go to the doctor, you pay lower out of pocket. So there is a trade-off here. At the moment, I'm paying about 420 francs for my basic health insurance, and I know that is a lot. And even I myself am shocked at the price that I pay, but because a lot of it depends on the canton that I stay, and where I stay, the prices of insurance is very high. I think it's due to the supply of health services here, which increases the prices of Swiss health insurance. It really depends on which area in Switzerland you stay. So I also suggest that you check out my video here about 10 things I wish I knew before I moved to Switzerland. That would also give you a little bit of explanation on how you should decide on which part of Switzerland to stay before you move here. One tip I have is that if you're relatively young and healthy, you do not require that many medical visits. Generally, it is better to just get the highest deductible so that you don't have to pay so much upfront monthly. However, if you have ongoing health needs, having a lower deductible might be more beneficial and cost saving in the long run. Just remember not to get the in-between, like either get the highest or the lowest. Being in between will just cost you more in the long run. Now let's talk about supplementary insurance. This is where things get a little bit more personal and varied depending on your own health needs. Now supplementary insurance, as the name suggests, covers the treatments and the services that is not included in the basic health insurance. So these may refer to services and treatments such as global coverage, dental care, having a semi or private ward in the hospital, also gym membership, or alternative treatments such as homeopathy, acupuncture, etc. Choosing the right insurance and the right health provider can be quite overwhelming. I mean, there's over 50 providers in Switzerland, and I wish that from the beginning I had someone that was able to give me advice and just run me through what are my various options and explain all the various jargons and technical terms, which can be really difficult, especially for a first-timer foreigner coming to Switzerland. And this is when I would like to introduce to you the sponsor of today's video, Ideal Group. Ideal Group is a Swiss health and financial services company that seeks to help expats navigate the complex world of Swiss health insurance. Here's why they are amazing. First of all, they offer tailored advice for health, life, and accidents insurance, so you have a plan that is personalized to your family's needs, not a one-size-fits-all solution. They don't just help you choose a provider, basically they explain all the various options that you might have, they walk you through the paperwork, they explain to you the various options and clarify any misunderstandings that you might have. Also, really important is how they provide multilingual support. Whether you are speaking German, French, English, Portuguese, their team is able to speak in multiple languages, and that makes explaining already a very difficult process a whole lot easier. Finally, I think what's really unique is that the group themselves are expats as well, meaning that they went through firsthand the same problems and challenges that we expats might face. And I think it's really nice to have someone that could empathize with your frustrations and the difficulties that you might face at the very beginning, because they went through the same things themselves and they could understand and relate a whole lot better. Plus, they stay with you long term, so if you require any changes further down the road as your time passes in Switzerland, they will be able to help you to make any adjustments suitable for your plan. If you need personalized insurance advice, check out Ideal Group on their website and mention my code OliviaXIdeal to get a free first-time consultation call. I will leave everything in the description down below, so do check it out. If you have watched through this part of the video, it probably means that you have found my videos helpful, and it will mean so much to me if you could click the subscribe button down below. It helps out a small channel like mine so much. At this point, I also want to highlight that I've created a Swiss travel guide with over 300 recommendations on hotels, restaurants, and activities that you can do all around Switzerland. My travel guide, it also comes with 5 standard itineraries, which is already prepared with daily activities planned out for each day, so you can simply plug and play and use it for any of your travel days. If you're interested, you can use my code Olivia10 for 10% off the full travel guide. I'll keep it in the description down below as well, so do check it out. And with that, let's get back into the video. Next up, let's talk about administration. Something very important to note is that once you arrive in Switzerland, you have 3 months from the time you arrive in Switzerland to get insured. If you miss the deadline, your canton will simply assign you to a random health provider. And trust me, it probably won't be the cheapest option. So it's best to gather your documents early and prepare all the necessary paperwork and start comparing plans as soon as possible once you arrive. Finally, I will just share some tips and hacks that I learned over the years, which I think is so useful to know beforehand. First of all, co-payment. I already mentioned it briefly just now. So basically it means that after you meet your deductible, you will still need to pay 10% of your medical costs out of pocket, up to 700 francs per year. So it's not a lot, but it's also something to budget for. So something to note at pharmacies is that medications aren't always fully covered. So if you're prescribed something by the doctor, ask your doctor for a generic version. They're often much cheaper. And something I also realized in Switzerland is that you don't get your medications directly at the clinic or at the hospital. Most of the time, how it works is that the doctor will give you a prescription and you're supposed to go to like the drugstore and the pharmacies elsewhere to get your medications. That's something very strange to me, because all the time back in Singapore, it's like wherever you go to the pharmacy, to the GP or to the hospital, you will get your medications directly at the hospital or the clinic. But it is not so in Switzerland. You get it elsewhere, at the random pharmacy or drugstore that you find. Something good to know. The third thing that is really important to know is regarding the deadline for annual changes. If you need to change anything related to your health insurance, for instance, if you want to change your health provider from one company to another, you can only do so before the end of November. So there's a very short time frame to do that. And during this period, all the insurance companies will start calling. You'll start receiving a lot of spam calls. Usually it's the health providers trying to persuade you to change to their company. So just be aware of that. This is also the period where you can start looking out for other options to find a better deal. So just be aware that you have this time period before November to make any changes required to your health insurance. Finally, it's related to subsidies. You can apply for an individual premium reduction if you have taken out a basic health insurance and your assets and income is deemed low enough to qualify you for financial support. This would very much depend from canton to canton, like the rules differ, the requirements are different according to the various canton, and you will need to submit the application to apply for it. This could save you a few hundred francs a year. It could be useful if you require financial support, and this would be something that a company like Ideal Group will be able to advise and help you through the process. And that's the end of the video. Overall, health insurance can be quite difficult and confusing at the beginning, but once you've got it sorted, it's just one less thing off your chest. I hope this video made things a little bit clearer and also gave you some insider tips. If you've got any other questions or you also have something to share which you wish you knew earlier, do leave it down below in the comments. Don't forget to like, subscribe and share this video with other expats which you think might find it useful. Thanks for watching and I will see you in my next one. Bye!